So this video might end up kind of like a Seinfeld episode where a bunch of different storylines all come together at the end. So just keep aware that I'm going to skip around a little bit. And you also might notice that I have tissue in my right nostril and my right ear. And I will get to that as well. So this weekend, I was helping out at a PRI seminar in southern New Jersey, and it was the myokinematic restoration course. And that's the first course that people really should take. It's about how the pelvis and the lumbar spine and the femur, the upper leg, all interact. That's the first one I took, and really the majority of what you do with people, if you're a PRI practitioner or aspiring practitioner or taking seminars, most of what you do with people will really be from myokin, because that left AFAR, how that pelvis moves on top of the femur on the left side and the right glute, all these exercises that are designed, or techniques that are designed to improve your neuromuscular strength of your left side, that will increase your test scores in the strength test, the Haruska adduction lift test. Those tests basically reflect your ability to integrate the muscles of the left side of your body. And of course, the first muscle you learn about is the left hamstring. And actually, I think the Institute was basically founded off the origin was to try to get the left hamstring back into people's lives, because of this left AIC pattern puts you in a position where the pelvis is forward on the left and back on the right. And I don't have my pelvis model with me today. It's in my car, and I don't feel like getting it. But pelvis is forward on the left, back on the right. And so you need that left hamstring to pull that pelvis back on the left side. And that is really your brain's sense of the grounding on the left side goes through that left hamstring and the left heel. So when your heel hits the ground as you're walking, heel hits the ground, the hamstring should activate to pull the pelvis back on the left to help rotate your body to the left, so you can shift to the left in the frontal plane and then rotate your torso back to the right. And that's what most of the techniques are trying to get you to do, one way or another. So that left hamstring is unbelievably important. It is the first muscle you really learn about, and it starts the whole process of getting you back to the left and holding on to the left side long enough. Some people really struggle with that left hamstring. When I was out so here I'm skipping to a different scenario, but it's all going to come back to the left hamstring. When I went out to Nebraska to get my eyes checked, the first thing Ron said after they looked at my numbers, my testing, said, "Wow, you're really going to struggle with that left hamstring." And not ironically, because he knows, I do struggle with the left hamstring in upright position. It was always two muscles that I really struggled to feel and hold on to. Would be the left glute medius and the left hamstring. I always thought the left glute medius was the harder one. Now I realize the left hamstring is still the harder one. I was able to feel the left glute medius in upright, just not consistently. I've never really been able to feel my left hamstring very strongly in an upright position. When I'm on the ground, I can, but and even actually on the ground, it's still not the easiest, but upright, it has always been a challenge. So left hamstring, I know, is still what I need to work on. So Saturday, I was helping out, and the instructor was talking about the importance of the left hamstring, and it was the lab portion of the seminar, and they were doing an exercise to find and recruit the left hamstring in an upright position. And so I'm doing it with them, because I knew, instead of just watching, I kind of started doing it myself, because I knew I struggled with that one. And I had done this exercise, but not a lot, and certainly not since I got my glasses. So I was doing the technique, and I felt a little bit of left hamstring, still not good. So I just filed that away in my mental file cabinet. Now, on Tuesday or Monday, I was working with a gentleman who I've known for many, many years. He's definitely sympathetically driven, pain in the neck and the back. And that's been going on for years and years and years and years. I suspect there might be something going on with vision, but at this point I still don't know. Anyway, I have him doing a vision test, not a vision test, but I'm just seeing how well he can be on his left side, on his left leg, and move his eyes. Interestingly, he gets increased neck tension whenever he's on his left leg and moving his eyes, depending on where, well, really just moving his eyes independently of his head, if he's on his left leg, causes an increase in tension. So we're talking, and then he mentioned that he had had nasal surgery, septum surgery, deviated septum surgery, many, many, many years ago because he couldn't breathe. So I thought, but he's also a mouth breather, which doesn't make sense because he can breathe through his nose, yet he's breathing through his mouth. And anytime you're breathing through your mouth, you're a mouth breather, you're probably getting too much air in, and that can cause a physiologic state of fight or flight. So I said, let's try this. Let's take tissue paper and put it in your right ear and your right nostril. Now, it didn't change anything, but what it did change was when I had him on his, it did. When I had him on his left leg, his body, instead of going to the right, so sometimes when people stand on their left leg, you see that their upper body is really still over to the right, so they're not really on their left leg. And that's what he was doing, and especially when he would move his eyes to his left or down, his upper body would go to the right, as if his brain was saying, there's no chance I'm going to let you move these eyes when your weight is on your left leg. However, when we plugged up his ear and his right nostril, his right ear and his right nostril, to prevent airflow, I'm trying to cut down airflow, he was able to center on his left leg better, so his body wasn't doing this, and it wasn't eliciting a painful response, an increased tension response in his neck as we did the same exact exercise. He still didn't feel comfortable moving his eyes to the left, but the pain didn't increase, whereas 5 minutes earlier, it did increase with the movement of the eyes. So again, I don't know what the issue is yet, but why did I do that? Well, because in the cranial resolution course that I took in August, this is about people who have their issues coming from up here. And until you can help resolve, until cranial resolution, until you can help resolve whatever's going on in the cranium, which is all autonomic, sympathetic, fight or flight, if you can't get this cranium to relax, the autonomic tension, the fight or flight, can't come down enough to access someone's muscles, like someone's hamstring, me, normally. There's still too much tension in the body, whether they're even feeling it or not. It's not providing, it's like a force field around your muscles that you have to penetrate until you can really access these muscles in a parasympathetic rest and digest state. So for someone like me, wait, now I'm skipping around too much. So with this gentleman, doing this didn't elicit more tension or more discomfort in his neck while we were doing the same exact exercise. So, oh, that's right. See, I knew I was skipping around. It's like a Seinfeld episode. So in August, when I was taking the seminar, I wrote down Sunday, 9:34 a.m. I closed my right nostril. I put a coffee stir between my teeth, right canines where I lack a little contact. Closed my right eye. This was before I got glasses. Closed my right eye. I was in a seated position, and as I did that, I felt my left hamstring. I never feel my left hamstring. What did I do? I did it on purpose, but I didn't know I was going to have that outcome. I was shutting down my right side. I was annihilating all right side sensory awareness, except for the right canines, which you actually need. You don't want necessarily right molars, but you sometimes need more right canine. So I was annihilating all my overly sensed right-sided sensory activity. I was trying to take these, we call them references. I was trying to remove all this right-sided reference from my system so that my body could go more to the left. And that's when I felt my left hamstring. So to make a long story short, 2 days ago, I thought, well, let me try that again. I tried the standing technique, and lo and behold, with the tissue in my right ear and my right nostril, which are the more sympathetic dominant side, I was able to really feel my left hamstring strongly for the first time in an upright position pretty much ever. So that was really cool. And what I'm really showing this is that some people need this type of stuff. Most people do not. I'm only doing this stuff for myself because nothing else was working. Most people are not cranially driven. But this is not treatment. All this is doing is lowering my sympathetic nervous tension or alertness, taking away the right side so I can access the muscles on the left side properly. To feel my left hamstring, as Ron said, I'm always going to struggle with this left hamstring because my visual system, which is getting better. To feel that, I have to annihilate my right side so I can feel my left side. And some people need to do that, and they might need to do it just for a little bit, or maybe they'll need to do that for the rest of their life, depending on what has occurred, the circumstances of their life. But again, this is not something I would have done right in the beginning. This has been a 7-year learning process, and even with someone else, I would still just try to do PRI techniques in the beginning until it's proven that those techniques are not working. Then we have to look for more cranially driven issues. And again, I can kind of see it right in the beginning because I can see their face, and faces tell stories. But the importance of the left hamstring, just to finish off, the importance of the left hamstring. I got this email, and I did not know this person, never spoken to this person. All they did was watch my channel, and they did the 90-90 technique. That's all they did. And what are they doing that for? Left hamstring. None of this stuff applied. So I got this email. I hope this letter finds you in radiant health and in best of spirits. I am writing to express my gratefulness for saving my son. I couldn't express through words how shocked they were using a translator, how shocked I got when I saw my son is walking again after 2 years stuck in a wheelchair. Thanks to you and your instructions via the videos, my wife and I are truly obliged to you for this. And I wanted to get a little bit more, I was kind of surprised. It started with lower back pain on the left side. He visited dozens of doctors all over the country. I'm not even sure what country she's in or he's in. Some doctors were telling them he needed major complicated surgery and that it was hopeless, drugs, blah, blah, blah. He's been in a wheelchair. He's had all these issues. Chiropractor, didn't have a good experience. We watched a lot of your videos and we followed the instructions for the 90-90 with hip shift video and how to fix a lateral pelvic tilt. And he's now out of his wheelchair and walking. That's one exercise, and that's the importance of the left hamstring. Obviously, he had insane amounts of pain and dysfunction, and he was in a wheelchair. But if the hamstring worked that easily, he didn't have any of this. He didn't have a real seriously complicated issue. He just needed to get the left side of his body back and use the left diaphragm. So if you can get your left hamstring to pull you to the left, and now it allows you to use your left diaphragm, and your right side finally opens up and relaxes because you got to the left, amazing things can happen. Was I surprised? I love to see this email. Was I completely surprised or shocked? No, I wasn't, because I know how powerful these techniques are and what it means, what can happen to somebody if they don't have their left hamstring and they don't have that left diaphragm in their life. Luckily, he's in his 20s, so he's younger, but that's how strong this can be. And you never want to lose track of the fact that even these more advanced techniques, they're not treatment. I'm only doing this to still help me get my left hamstring. And that's really the point of all this, is that left hamstring is insanely important. Just working on left hamstring is beneficial, even if you're not sure where else to go with it, as long as you're feeling things properly.